So interesting study was done years ago where they took animals. I think it was a dog study, but they took animals who had torn cruciate ligaments and followed them for a couple of years after the incident occurred. And 50% of them had surgery, and 50% of them had not had surgery, but had rest and non-steroidals and medication. And interestingly, what they found was the same amount of arthritis with surgery or without surgery, and the same amount of sort of leftover degeneration in the joint, no matter which way you went. And it's easier with smaller animals for them to recover. I think with 70 plus pound dogs that blow out cruciates, if they don't have surgery to repair them, I think a little trickier for those guys to really rehab. For instance, Gwen's dog that had surgery, the TPLO surgery, she races around on that leg with no problem at all. Her problem is now she's got a lameness in the front end, and I think it's the opposite shoulder, which makes sense. So that probably means that she is favoring hopping off that back leg a little bit. If we did some weighted stance studies to see how much weight she's bearing on each leg, she probably is bearing a little less on the leg that had surgery. And so I think what it's doing is it's straining the front end. Animals carry 60% of their weight on the front end, 40% on the back end. So if we're hopping off the back end a little bit and we're getting 70% or more on the front end, particularly if it's unevenly weighted, we're going to get gait changes. So Mila struggles if she's really active. For instance, they were out at the barn a couple weekends ago when we were organizing the tack room. Mila and Panda just raced around all day, rolled in the mud, carried on like crazy. And poor Mila suffered for about a week afterwards with being pretty lame in the front end. I kind of expected her to be hopping off that back leg, but that repair is holding up really well. So what's really interesting with these cruciate injuries is there are so many ways they can be treated. You can have surgery performed. You can do rest and then PT and strengthening exercises. A lot of people are going to doing stem cell therapy or PRP, which is platelet therapy. You can also do prolotherapy, which is where an irritant is actually injected into the ligaments that surround the joint capsule. Honey, can you put Gabby out? She's about to spin and go. You can do prolotherapy, which is injecting irritants into the ligaments that surround the joint capsule, and the scar tissue that builds up actually stabilizes the joint. So there's a lot of different ways to approach it, and sometimes not spending $5,000 on surgery, but putting the resources into strengthening the joint and decreasing the inflammation in the long run can be more appropriate. So big dogs need very experienced surgery. I know of a Rottweiler, can't even tell she had surgery. Yeah, I mean, would cold laser help with the front end? Yeah. Biggest problem we have with Mila is Gwen's taken her to their specialty center a couple of times, and they cannot localize the pain. So we don't know if it's coming from her neck. We don't know if it's coming from her shoulder, her elbow. She never complains, no matter what you do. This is where it would be really nice to have that thermal imaging so that we could get a better idea where her problem is. So I told Gwen to bring her over and we can do some chiropractic on her. But we haven't been able to isolate exactly where the tenderness is. So it gets a little tricky to just go in and say, hey, laser the whole dog. Let's do every joint in the front end. Let's do her neck. We can do that. It'll just take time. So it would be nice to be able to localize the problem a little bit more. So Gwen's almost thinking perhaps an MRI is going to be needed. I know she has insurance for her that she got right before the dog ate the diapers and wipes. I don't know if the insurance would cover the front end, since I don't know if she was seen for that and whether it would be a pre-existing condition. So Suggestions for a 13-year-old cat with glaucoma, had one eye removed. Now a year later, the second eye is blind. Yeah, once they're blind, cat can't see anyway. If it's a painful eye, it's really better off being removed. You know, you can use herbs and things to try to decrease blood pressure. In general, there are topical drops you can use for that, but I struggled with that with Laura Lou, my first English toy. Once she became completely blind, the eyes are painful and they had to come out. So do those shots in your own shoulders, torn rotator cuffs. Yeah, well, again, I think that a lot of times, instead of looking at alternative therapies, of course, surgeons or Mittens, I took him to a surgeon. What was she going to say? Need surgery. So surgeons are going to recommend surgery. Whereas if you go to someone who maybe does sports medicine or rehab, they may have some other options for you. Okay, we got to get to the barn and feed, and just lots of stuff going on. I got work to do, always.